So we're going to position for flexion and extension of the lumbar spine. And I will demonstrate on myself how you would position for this study. We're going to start with a 14 by 17 collimated area. We don't want to collimate in because we don't want to cut off any of the spine. We want to place our marker outside of the area of interest. And next, I'm going to ask the patient to stand with their right or left side against the bucky. You want to have your collimated central ray at the mid-coronal plane and at the level of the spinal fusion, or where they would be having surgery. So in this case, just want to make sure that the mid-coronal plane is centered to the IR. And for flexion, you're going to ask the patients to bring their arms forward, separate their feet a little bit so they're nice and steady, and bend as much as they can forward. You would ask the patient to hold their breath and then breathe. That's flexion. I recommend that you use a manual technique for this because the spine is not going to be centered to the center cell, so it works out better that way. Now for the flexion, I want to make sure this is out of the way, which is not going to move. For flexion, again, you're going to position the patient standing. The mid-coronal plane is going to be centered to the IR, and again at the level of the spinal fusion, and you're just going to ask the patient to bend as much as they can. And again, it depends on a patient's condition. They may or may not be able to bend backwards or forwards a lot. So whatever the patient can do, that's what they will do. Ask the patient to hold steady and hold their breath and breathe. And that is flexion extension. Now, you can also do this recumbent, but you can do it erect as well.